showcasing classic characteristics in this TRUWELLTH's personalities and peculiarities impact on diabetes. Dr. Anil Bhoraskar now presents therapies that are effective in managing diabetes. Personalities and peculiar behavioral characteristics influence what you eat, when you eat, and what fitness regimen you follow. Globally, diabetes epidemic is observed to be a result of unhealthy lifestyle and dietary patterns, as they are shown to greatly influence development of insulin resistance in the body cells and loss in insulin production by directly or indirectly causing damage to the beta cells producing insulin. Dr. Anil Bhoraskar, renowned diabetologist practicing at the coveted Raheja Hospital, Asian Heart Institute, and Asian Cancer Institute in Mumbai, India, talks about how nutrition and diet is important and needs to be personalized and must be integrated with the treatment advice from your diabetologist. TRUWELLTH Nutrition and Health Center emphasizes on personalized and integrative management of diseases and is therefore proud to bring to you this episode of Diabetes Management with Nutrition and Diet with Dr. Anil Bhoraskar. We realize how difficult it is to consistently make good food choices, follow a fitness regimen, and lead a perfect lifestyle. So our primary focus is to help you become a healthier you with a responsible and personalized multidimensional approach that addresses your health concerns effectively and with your personal and professional lifestyle and limitations. You can feel free to reach out to us at TRUWELLTH Health Center for taking advice from these stalwart doctors and nutrition experts.
Well, friends, I think we have discussed in last 5 episodes various personalities and how they change the treatment modalities and the effect of the treatment by sheerly understanding their peculiarities and their personality traits. Now, a last few episodes that we have decided is we'll talk about what is really in interest of all my diabetic patients who are following this program so diligently that I feel that it's about time that I give them the real useful information for their day-to-day management of diabetes. So we are going to divide the programs into 3 episodes. The first one is the therapy for diabetes, which is of course the cornerstone of the treatment of any disease is the diet and nutrition. Second is the new line of treatment, new drugs. The menu for diabetes has increased enormously in the last 10 years. There are about 10 or 15 new drugs and 4 or 5 new insulins. And I think it's about time that people must know about the scientific basis and also the role of each pharmaceutical agent and how beneficial it is to overcome the problems related to diabetes. So let's start about the diet therapy. Diet is always said as a cornerstone of the treatment, but it's probably one of the most difficult things to do. And there are so many write-ups about various types of diets, various food products, the beneficial effects of so many products that we have not heard earlier. And that's the reason whenever there is a lot of write-up in a regulated as well as non-regulated press, we have a lot of confusion. I need to tell you one thing, that there are extremely talented and well-read scholarly dietitians who have enormous study of the food and the food products and their effect on human body. But I personally feel that all this theory, what we understand from these high profile dietitians and their nutritional concepts, which make a lot of sense, and there is a lot of theory and a lot of science involved in many food products. But I think the patients ultimately would like to listen to a person who is the end user and who sees the effect of these dietary practices on a long-term basis on human body, mind, soul, and actually see the effect of this diet in a clinical practice. So I'm not trying to say that dietitians are not to be taken seriously. They are on for all of us consult them from time to time, and we try to understand the intricacies of various nutritional products as well as factors. But exactly how it affects the human body, as we get to see these patients clinically, we see the complications clinically, we see the role of salt restriction in management of hypertension, we see it clinically, we see the reduction of cholesterol in diet, how it affects the coronary arteries. So, it's very important to really sum up this extremely fine theory which is given by all these high profile dietitians and who advise very rightly to people what to eat and what not to eat, how does really affect the human body. So for that, I think for people to understand, let us understand that in Marathi we say Anna he Purna Brahma. You see, the man is what he eats. Man is what he eats. If he eats pig, he looks like pig. If he eats a sattvic ahar, he looks like a sattvic man. So there's so much of effect of your food on your body, your skin, your eyes, your brain, your mind, your thinking process, and therefore we need to study food very seriously. Although food categorically is classically divided into the constituents of food, which is very simple. From childhood we have learned it contains fat, carbohydrate, proteins, minerals, antioxidants, trace elements, salts. So it is divided grossly into that. And all of us need all the constituents of this for survival. But exact proportion of these constituents and in the kitchen lingo, which is so difficult in our country, and all the constituents of the food, if you really consider what is beneficial to your body, mind, and your disease and your particular problems that you have, if you put them into kitchen practice, it will have 4 important issues which are not related to the science of diet. They are related to culture of diet. Now, food culture is your culture which varies from community to community, from caste to caste, from area to area. Although the constituents may have a same proportion and a same content, the taste varies, the cooking methods varies, the cooking styles vary, and therefore to combine all this together to give a dietary advice is extremely difficult, and therefore many times I discuss the constituents of food. I give them roughly how much proteins they are going to need, how much fat they are going to need, how much salt they are supposed to take, what is the cholesterol containing foodstuff. I discuss that broadly. Now about the cooking processes. Now today what has happened, there are many cooking methods which are new to us and which are definitely healthy. Many cooking methods are either dry heating, boiling, broiling, saturating. There are so many new processes which have come up in a great deal of practice and are useful than your conventional cooking, because conventional cooking, our main concept in a diabetes diet prescription is to reduce the fat content, the carbohydrate content, and a salt content. All these three things, when you try to reduce, you have to consider the palatability as well. Now you will realize that if you reduce the quantity of fat, obviously the people who are used to eating a fat fried, deep fried, shallow fried, or whatever way the fat was used for cooking formerly for years together, the palates which are developed from childhood, it is impossible to like the food which is containing less fat. So it is a question of training, and it's question of getting used to a low fat, low salt diet, which is a big ordeal for many people. And that sometimes can be made worse when the dietitians give a very difficult to follow advice. They talk about products which are not familiar. Now that makes a lot of problem, particularly if you write a diet to a person who has never eaten those substances, who has never eaten those type of recipes. How are they going to cook that? And therefore, I think the practical aspect of prescribing diet is to understand the first principle in a diabetic diet is to reduce the fat content. Now, we call it oil crisis in diabetes. What is oil crisis in diabetes? There is so much of dispute and debate on which oil to use. And even authorities vary from person to person. There is a great difference of opinion between the cardiologist and a diabetologist and a nutritionist at what cooking oil they should use. Very difficult to stick to one single brand of oil. And therefore, many authorities advocate a blending of oils. Means what? You buy various types of oils. Basically, oils are nothing but a fatty acid chain. The fatty acid chain are CHOH, which is bound by single bonds. Now, when the H ions in this fatty acid are dropped, they become polyunsaturated fatty acids, and the C to C binding is done by a double bond. And these double bonds, at what position of carbon they are, whether this is the third carbon or the sixth carbon, it is termed as a omega-3 fatty acid or omega-6 fatty acid. Now these are the new concepts. But it is very important to know that the fatty acid in your oil that you eat is an important constituent which can result into a widespread disease. And the idea is to reduce the content of omega-6 fatty acid and increase the omega-3 fatty acid. Now it is impossible to increase omega-3 fatty acid in your diet which is only vegetarian. Omega-3 fatty acids are predominantly seen in fish. But we talk about the ratio of omega-6 fatty acid to omega-3 fatty acid, and it should be between 1 and 8 or 1 and 10. Anything more than 10 is risky, and particularly all the vegetable seed oils which are promoted as heart-friendly cholesterol-reducing fatty acids, they are very rich in omega-6 fatty acid, and their ratio of omega-6 to omega-3 is more than 100. And these are very commonly used oils. And therefore, in order to increase the palatability of the food, it is important to use the blends of oil. So what do? You use 1 teaspoonful of corn oil, 1 teaspoonful of rice bran oil, 1 teaspoonful of groundnut oil. Olive oil is normally not a constituent of Indian diet. All our recipes are at a high temperature. Olive oil, you cannot use it for boiling or frying because it has a low smoking point, and at 80 degrees or 85 degrees olive oil smokes, and a smoking oil is highly atherogenic and carcinogenic. Therefore, I do not recommend olive oil for our Indian cooking. You can use olive oil to garnish, you can use as a salad dressing, because olive oil is a monounsaturated fatty acid, like peanut oil, like groundnut, monounsaturated. Polyunsaturated fatty acids are commonly used. Unfortunately, what has happened, because the media as well as the promoting companies have popularized this oil so much that they gave a feeling to people that you can eat the polyunsaturated fatty acid, any amount. Anything that you cook, fry, deep fry, samosas, bhajia in polyunsaturated fat, it is definitely safer than eating it in ghee or saturated fats. And as a result of which people started eating polyunsaturated fats any amount. Now you have to restrict the amount of the polyunsaturated fats in your diet, not more than 2 teaspoonful. So the virtues of our traditional fats people have forgotten. What was our traditional fats? It was homemade ghee, it was coconut, and these are condemned as saturated fats because they would freeze at a room temperature less than 20 degrees, and in the cold season, coconut as well as ghee will become solid. So they said that ghee increases cholesterol. Yes, animal fat and dairy products are to be reduced when you want to combat cholesterol. But using 2 teaspoonful of ghee in a day, not in a frying pan, again it is very important. If you put ghee in kadai, which is made of black metal, which comes in contact with oxygen and forms what is known as cholesterol oxidase. This oxidized saturated fat is highly toxic, and therefore ghee only 2 teaspoonful in a day is to be garnished, it is to be put on the top of the food as we eat. On this varan bhat, we put a teaspoonful of ghee. That is a healthy way of eating ghee. But a deep frying food in ghee, we do not recommend. So in kitchen language, you'll realize you cannot exceed more than 2 teaspoonful of ghee and 2 teaspoonful other forms of oils, either sesame or rice bran or mustard. Nowadays there is a bit of write-up about mustard because this mustard causes some kind of rhythm disturbances. Recently there was an article in South that the mustard cause some cardiac arrhythmias. So mustard oil is slightly, there is a cloud on that. And luckily in this part of the world we don't use mustard much, but North Indians like to use mustard. But rice bran oil and sesame oil, and in the monounsaturated groundnut oil, not more than 1 teaspoonful each, and that's all the person can eat in the whole day. Now this is changing your culture. If you are not going to do deep frying, and if you are using cooking media which are not traditional, where you put a kadai and then put oil and then wait for the fodni and then put all the substance in that and deep fry and keep on frying till the whole food is soaked in oil, and that gives a palatability. That has to be changed. People have to change the cooking processes, And there are about 10-15 different types of cooking methods like microwave, like using a non-stick utensils where you need less amount of oil. You use a spray of oils. You don't have to pour oil by tablespoonful and cause deep frying of food stuff. So this oil crisis can be resolved by changing your palate slightly and taking into account that the calorie forms are definitely based on the fat content, because remember, 1 gram of fat gives you 9 calories, while 1 gram of carbohydrate gives you 4 calories. So if you increase your fat intake, automatically your calories go up. And if you want to restrict your calories, first thing you have to do is to reduce your fat content. Now, dairy products also, we recommend to take dairy products, skim milk, 1% fat milk, avoid cheese, or you can take fat reduced cheese, there is available fat reduced cheese, yogurt you can take, butter you should avoid or reduce in quantity, and dairy products are particularly useful because milk is a very important source of calcium. You need 400 milligrams of calcium. There is no other source of calcium. So I am not there to condemn the entire dahi. Dahi yogurt is particularly very good. A freshly prepared dahi without much of cream is also needs to be added. But you have to consider that you can't exceed it beyond a certain amount of not more than quarter liter per day per head. So these are the main areas where I would like to focus attention. Now, carbohydrates. Obviously, for a restriction of calories, you have to restrict the carbohydrates. Now, basically, Indians are carbocentric diets. Indians eat carbocentric diets. Now, what is a carbocentric diet? If you see our diet, which contains almost 60% carbohydrates, and largely because culturally we are used to rice, wheat, even vegetables contain a lot of carbohydrates, because the carbohydrates are easiest source of food and at a cheaper cost. Carbohydrates are cheap compared to proteins and fat. And we all eat carbohydrates in our country, and our lunches are also carbocentric, as a result of which Indians, particularly ethnically Asians, we have a problem managing postprandial blood glucose. If you ask a type 2 diabetes, which is a major problem, is to not able to control his post-lunch or post-breakfast blood sugar less than 180. They are always more than 180, 200, and then we need to give some drug to bring it down, because the complications of diabetes start coming up when a person's post-lunch blood sugar is persistently high, and which is a risk factor which eventually causes elevation of HbA1c and uncontrolled diabetes. So how do you control lunch-related surge of blood sugar? Obviously, you have to reduce your carbohydrates. Now, reducing carbohydrates is going to be very difficult because culturally we cannot change our diet. So what do? What we recommend, we ask them to take a good breakfast. Now, vegetarian people don't eat eggs and other form of meats in the morning, so they have to eat protein breakfast. Now, protein for them, the source is either paneer, but again it causes a rise in dairy products. Sprouts, which are very important. A bowl of sprouts, grams, udid containing carbohydrates. Like for example, idli, dosa, it contains 30% udid and 70% rice. So eating only rice, it is better to take idli or dosa because it contains 30% proteins. So you have a reasonable 300 calorie diet as a breakfast. Many people don't take breakfast. They are in major hurry. As soon as they get up, they have to go they take a toast and maybe a cup of tea and rush. Now that is dangerous because that will create all of counter-regulatory hormones in the morning and will create many problems if you don't take. So eating a good breakfast with some nuts, yogurt, and about 300 to 400 calories you eat, then you can reduce your lunch carbohydrate load. How do you do that? For carbohydrate load reduction, you can have a bowl of soup or a salad and maybe one toast of bread or one roti roll. That will cut down your calories by carbohydrate by 50%. Evening you can have a snack, which is again a simple snack like upma, dalia, but not farsan, not vada, not bhajia, not vada pav. Those things should be avoided in the evening. You can have evening snacks around 200 to 300 so you don't feel ravishly hungry in the night. And at night you can have a very light dinner. Predominantly you can have a fruit, you can have salad, you can have chas. Cut down on the rice at night. Have a wheat or bhakri. One of the very good substance is multi-grain bhakri at night. Bhakri has got three types of ingredients. One is nachni or millet, which is full of iron. Then you can add jwari, bajri, a little bit of wheat and little bit of maize. This panchadhanya bhakri, one bhakri is filling. It gives you less carbohydrates and adequate fiber. This is very important because fibers will give you satiety and it will also move your bowels well next day morning. Plus it is reducing your calorie load. Now this is particularly our day-to-day diet. The Indians are particularly known for their festival times. It's amazing to know that in 365 days we have 200 days of festivals in India. That means that 200 days people eat something sweet, something nice. No harm. That's the one positive thing that you do, makes you feel nice. The family likes you to eat because they want every day you are dieting, one day you can have. But now these temptations of eating sweets can be reduced. In the sense, you can have sweets, but you can avoid simple sugar. Now there are a lot of sugar substitutes and there are a lot of recipes now available where the sugar substitutes can be used to make sweet dishes. And if somebody has a really sweet tooth, the fruits can help you. The fruits that you can eat are cherries, strawberries, then pear, peach, plums, apple, yellow banana. In a season of mangoes, you can have a half a mango, no harm, because it contains fiber, not more than half a mango, more than. You can't have amras, and you can't eat amras poi. You should take fruit after a gap of 1 hour from food. Keep a gap of mango and food 1 hour gap. Then it will not cause surge of sugar. It will not cause glycemic excursion or glycemic what they call it variability. So fruits you can take, seasonal fruits are created by God. I always used to tell people that ईश्वर निर्मित सगळ्या वस्तू खा, मनुष्य निर्मित वस्तू खाऊ नका. What is मनुष्य निर्मित म्हटलंय? मिठाई, chocolates. It is created by man. Obviously what God has created, it is for the benefit of humans. You must know that how much to eat is also very important. When people bring mangoes from Ratnagiri, suddenly I think 24 mangoes ripe at the same time. So family considers this as their responsibility to finish it in 4 days, which is wrong. To distribute these mangoes in your neighborhood. And you can have half a mango every day, no problem at all. So these are the few tips that I would like to give you for dietary practices. Now change your diet according to season. In summer, take salads, soups, try to keep light. In winter, you may need little extra fat. Now you should know the wisdom of our forefathers has really taught us what is known as Rutucharya. That is a change of diet according to the season. And India, we have essentially 4 seasons, but predominantly there is a winter and summer, and of course rainy season. But the dietary practices culturally vary during summer and winter. There is a great scientific basis for that. And this you have to follow. You have to give respect to your culture and your tradition, because that is useful to our body and our genomics or pinda. For thousands of years, our ancestors have taught us to bring about changes in diet according to the season. For example, during Sankranti, we use til gul. Now, gul is a jaggery which has special qualities, and til which contains fatty acid. And that's the time you need the sesame oil during winter in order to prevent all winter related disease. Only thing, you can't overindulge. Just because somebody has made laddus, you can't eat 10. You have to be moderate in the changes and what is really helpful to you. Like there is some function in Vasanta Panchami where you use kairi sapana and dal. What is the rationale in that? The kairi has a many beneficial effect, including vitamin C. Now, summer time is a time where you lose a lot of water soluble vitamins. You need to increase your vitamin diet in summer. So this changes, you follow your cultural practices intelligently, not in a way where there is a obnoxious use of fat, like deep fried food and putting lots of oil in the diet in order to increase the palatability. That should be avoided. And a change of diet according to the season is definitely beneficial. And I'm sure once you understand the principles of diet, you can make changes according to your palate, according to your culture, according to your traditional cooking styles, and likes and dislikes of the family members. Thank you very much.